Recurrent miscarriage is a very common problem that we see in our practice. Couples who have had at least 2 miscarriages should be evaluated for recurrent pregnancy loss because we know that their chances of having another miscarriage without a diagnosis is about 25 to 30%. The diagnosis of recurrent pregnancy loss and the reasons behind it, we would take a look at both structural causes, so making sure the uterus and fallopian tubes are healthy, and we would also look to make sure that there aren't any hormonal or genetic reasons, mainly through blood tests. And it's very important for a complete evaluation to be performed for couples who have recurrent miscarriage because in about 30% of people who have at least one reason for recurrent miscarriage, they have more than one thing actually going on. After we've done the initial testing, we're able to pinpoint what we need to actually treat. So if there's a structural abnormality, surgery may be necessary. If there is a hormonal abnormality, sometimes medication can be administered. If there's a blood clotting disorder, sometimes blood thinners need to be used during pregnancy. A common cause of recurrent pregnancy loss is that the embryos that are developing are chromosomally abnormal. What we know about recurrent pregnancy loss is in couples who have recurrent pregnancy loss, most of those people are going to be able to successfully conceive. However, we don't know if that's going to be after 2 or 3 miscarriages or 6 or 7 miscarriages. So some couples would choose to use IVF with pre-implantation genetic testing or PGT so that we know that the embryos that are going inside their uterus are chromosomally normal, thereby giving them a higher chances of pregnancy with their next try.